Sé tinnis tuchtteach ingin tinnis an nervus cumanta an na labéniu, agus suring a bua thuir duine sa mí ag aim sa mí. An na labib hat se michel cúgad sa céir míleneacha fulling leis an tinnis tuchtteach, siad duine imach a gach 9 sa 6 cneach. Ha cóir cerad seo se cuarstan agus dócha gynnig barach go rééis seo se cuarst itneach. Chanelach cúgad sa gas sa chiad de gúine a bhfuilin tinnis tuchtteach an amríchtin na heile fulling le cuarstan. Ach has a gra go mórin seachgad sa chiad a bhí súnis cuarstan le na lios an cearst.
Because there are many drugs, it means there are many side effects that are unique to the different drugs. The list is endless. You would only have to open up a book on them and see what can happen. And every patient has an individual experience on that. But it is correct to say that these drugs are not innocent drugs. That's why we only use them when we have established a safe diagnosis of epilepsy, because with every effect there can be a risk profile with that. And so the medications have to be watched as well as the seizures themselves. I think the stigma is massive with epilepsy. If you are not accustomed to seeing seizures, they are very distressing. To anybody on a street who comes across somebody having a seizure, it looks a very, very scary event. And so comes with that then a social stigma. People don't want to see it, it scares them, and it really can leave patients very isolated.
Ha a bhór chuid siad a bhfuil in tinnis tuchtteach a camal smachgar le cungín leis.
Epilepsy doesn't have one identified cause, and it's wrong to say that epilepsy is the disease. Epilepsy is a consequence of some dysfunction of brain, and there can be many, many reasons why that happens. Depending on the various reasons, it can give you different forms or different severities of epilepsy. And so it's actually a very broad brush describing lots of little different things going on.
Cónar in na cungín leis avisteach a has a clachgig son in tinnis tuchtteach. Ha cúideach dóin leis a rialachte rí iachin.
Bhí chuid is mód a géine a drogigin de chearsa chorigin uadna na gá. A cha cúide géine ann agus ha dúlich, chanel is bíd ha de gáil, chanel sin na cúd stata na seizures, sa gan an hidrú den bagan is anna síche vis dúine fiachin agus hamas mioch bíad gáil cónal van a neurologist mai sin.
I think when you're caring with a child that has got any kind of additional need, whether it's medical or behaviour or support, whatever, that becomes your sole purpose. That's what takes over everything in your life. As the years progressed, Egan had clusters of up to 25 and 30 in a day, once reaching 38 in one single day.
I would just stare into space and I'd be smacking my lips and kind of clenching my hand as if I'd feel as if time stopped and I was just staring into my day and not having a clue what was happening. I could feel my stomach kind of turning, and then when I had my seizure, I felt like something come up my throat, so it was as if it came from my stomach, and then it was kind of like a bubble in my throat, then it burst, and then that was kind of the seizure ending.
Egan was having a lot of seizures, and they had a real significant burden on him on his day-to-day life. People don't really underestimate what a significant impact. He's a young boy trying to be at school, trying to be doing what all other kids at school his age are doing, and to have continued ongoing background epilepsy affects his learning, it affects his socialization, it affects everything, every part of his life.
I think the worst thing about it was it caused me to obviously have temper tantrums and hissy fits in class. So, because it was in the temporal lobe of my brain, so that was the kind of worst part about it, because it was kind of causing me to be angry and I couldn't really control it in a way.
For 4 years, Egan tried about 7 different anticonvulsant drugs, and the further down the list of suitable drugs you go, the less chance of them being successful. At one point, he was taking 3,600 milligrams of meds a day.
One of them, I can't remember the name of it, but it made me look really furious after I'd taken it. So, and also it kind of kept me up at night because it was like really, I guess you could say it was a bit like sugar, it kept me like really hyper.
I think they'd obviously gone through the experience of having an epilepsy condition that was not successfully treated and was having an impact on him and on his family and all his friends and everybody associated with Egan. It was very, very difficult. I'm sure life was almost an impossibility in ways to manage. And so surgery was seen as the only other alternative option, having investigated him.
I was a little bit scared at the surgery, but I wasn't really petrified. I wasn't screaming and wanting to go home or anything like that. I was just worried in case, because I did hear Mr. O'Kane say in one of the meetings before my mum the aftermath that could happen of it, so I could maybe come out a bit not intelligent because my brain had been gone, or maybe I could become out even paralysed or not allowed to do some things that I wish I could do. And I was a bit scared at that, but then I wasn't really scared of the surgery much because obviously I didn't know what was happening, I just knew I was getting brain surgery.
There's a risk operating on the brain that you can actually create seizures. So you may actually give them a different type of epilepsy or exacerbate their epilepsy, so in effect make the situation worse. You could damage brain, which may affect their speech, it may affect their vision, it may affect the strength down one side of the body, it may affect their intellectual learning. It can affect anything, but it is really important about which part of the brain you're trying to operate on. People deserve to live seizure-free, and people make that decision. And I think that reflects the burden of epilepsy on patients when they can weigh up risks that include risks of damage, of stroke, of small risk to life, and they would say, I'm willing to go through that, small as it may be, because the epilepsy is such a burden on me. And I think that's a telltale sign of just what a condition and what an effect that this can have on patients.
The day of Egan's surgery was probably the hardest day of my life. Obviously I was quite tearful and I felt physically sick. I was worried. I looked at Egan thinking, oh my God, what boy am I going to come back to? And it was always in the back of my mind, if we had suffered any of these horrific side effects, if Egan asked me, did you know that could happen, Mum? I would then have to say yes, but I still let them do it to Egan.
We figured he had what they would term temporal lobe epilepsy. We found an abnormality. The EEGs, or the electrical activity of the brain, measured the electrical storms or the seizures coming from this side. This is just some of the footage of Egan's actual operation from the microscope. We do this under a microscope to orientate yourself. This is his temporal lobe here, and this is his frontal lobe here. So we are looking at this area of brain. This is an edited version of the operation in essence. This is us removing the normal area of brain to try to get to the abnormal area of brain, and you can see us working to remove this. Very fine down here, you can see the brain is normally a beautiful white structure. And that's the abnormal area coming away. You will see the abnormality down here. If I move that out of the way, it looks sort of brownish coloured. Okay, this was the area of creating the seizures. So this is us removing that area in essence, which is lying to the medial side of his temporal lobe. And it just takes a bit of time to work your way through that, and obviously not go too far, because too far would put you into tiger country.
I think I thought he would be hooked up to wires and tubes with his head all bandaged, and he was sitting there and the first thing he said was, "Where have you been?"
Our reply back was to hell and back about 17 times, but I was chuckling at that for a wee while.
As the weeks went on, week after week, we were waiting for the seizures to reappear, and they didn't. He has now been seizure-free for almost 5 years.
It's definitely a miracle cure. I don't know. I can't thank Mr. O'Kane enough.
Egan is now back to being a normal young man. He can carry on with his life as anybody else would. He now does not have epilepsy.
Egan is my miracle boy. He is 14. He's almost 6'5". He's seizure-free. He's medicine-free. Unfortunately, he's not teenager behaviour-free. However, that's what we can cope with. He's happy.
I love my mum. I wouldn't be where I am right now without her, to be honest. So I'm thankful for her being my mum.